Good evening and welcome to the Pandemic Podcast with me, Dan Astin-Gregory. In tonight's episode, we unpack yesterday's decision to U-turn on the vaccine mandates in England within the NHS and the wider care sector. We call this episode One Small Step Against Mandates and One Giant Leap for the NHS. So if you hadn't seen already last night, the Health Secretary Sajid Javid made a statement which made a full U-turn on the, when I say a full U-turn, we'll unpack this piece as we go through, a U-turn on the mandates that threatened the livelihoods of somewhere between 70,000 and 100,000 NHS workers based upon being double vaccinated. Of course, that number would have risen substantially if it required three shots like the rest of the population with the booster program. So the livelihoods have been saved here. Obviously, now this is a critical campaign that we've been running with a number of different groups to flatten the mandates. We gave 10 days to flatten the mandates, given the dramatic timescales that we were under here. Because if the staff, if this policy hadn't changed by the 3rd of February, then we really would have lost these jobs. Would have been these individuals within the healthcare of all expertise and backgrounds would have had their careers cut short, and they would have been served their notice. In fact, I spoke to a nurse last week who is in the final year, her 6th year of her training, and she would have lost her job before her career had even started. So this is, on one hand, very positive news for the NHS, and it's important that we do celebrate this. You know, it's a successful campaign. Now, Sajid Javid, in his statement, attributed the decision to the situation as it pertains to Omicron variant, as opposed to the widespread campaigning and public shift in opinion that it resulted from such campaigning. Of course, he's not going to say, you know, hats off to you guys. You really backed us into a corner on that one, because that would leave the wedge the door wedged far too broadly open for further criticism and challenge, which of course is what we will continue to do, because much of what we've witnessed over the last 2 years has been equally nonsensical and has caused wide sweeping harms. But nonetheless, the great news with this particular U-turn is that, of course, these jobs are now saved. That's incredible for each of the individuals who are going to be affected here inside the NHS and the wider healthcare system. And of course, given the challenges that have been caused through lockdowns and various other mandates and restrictions, we know that the NHS waiting lists are at record levels, with over 6 million people waiting for treatment or diagnosis. This would have been radically impacted if we'd seen the loss of 100,000 workers across all kinds of expertise. In fact, when I went to the protest in London, I spoke to NHS workers of all backgrounds, senior consultants, people from neurologists to nurses to surgeons. Just such a breadth of expertise would have been lost from the NHS. And of course, it takes many years to become qualified and deepen your practice to a level where you can actually perform some of these tasks within the healthcare system. We'd have simply lost those overnight at a time where the NHS is already under pressure. I mean, when did we not hear a story last year about how the NHS was under pressure? Yet the government had made a decision based upon a vaccine policy, the government's own decision, which would have threatened the NHS even further. But of course, the government haven't taken full responsibility for their flawed policy, which we'll talk about in a minute, because what I will show is the actual text. I've got the transcript from the announcements last night, and you can see that whilst this is a big cause for celebration in terms of this U-turn, we must remain cautious, because, as always, the perpetual threat of restrictions and mandates is never too far away. And plus, this is one small step for mandates, full stop, because, of course, this really has become a perpetual mindset and ideology around the world, this idea that it's acceptable to mandate vaccination to the population at large and within sectors of the industrial complex. But this is really still a very big problem around the world. But it's our hope, and it has been our hope with the campaign that we've run here in the UK, to flatten the mandates, that we would send a ripple effect around the world. And it's my belief that it will. It is truly my belief that this will. The news yesterday was syndicated around the world. I was contacted by people in various different parts of the world who told me they'd received the news and they were really hopeful that they were able to replicate the situation in their territory. So this may seem like a small win, but it is a major win. It's a major win for the NHS. It saved countless jobs. Some of those individuals I had the opportunity to meet at the weekend when we were protesting, they were devastated. There are as many people registering for unions to be supported through this process as there are registering for mental and emotional support, given the turmoil it's put them through. So we have to think about the individuals here and how they were affected. You know, the heroes of yesterday who were clapped throughout the period were going to be tomorrow's victims. And it's just superb news to know that their jobs and livelihoods have been saved, but also more broadly for us as the public, knowing that the healthcare system has not been undermined by these decisions. So I'm going to take us through some of the. So I smile because it's just this is. I mean, I had to pinch myself this morning. I was looking for a photograph with my camera, and it was from 4 years ago, and I was like, crikey, the last 2 years. Really? We're still doing this 2 years on? 2 years, folks. 2022. We're still in this space. Are you serious? It's this. The vaccination condition of deployment. This is from Monday night. I'm just going to show some pieces from Sajid Javid's speech. This is from the transcript. I just want to highlight this point here. So Sajid said that even with progress, of course, remain vigilant. This is my point around always remaining this perpetual threat, and this is illustrated quite clearly here. While overall cases and hospitalizations continue to fall, we are seeing rises in primary and secondary school children. Case in point on that, just watch this space about how we'll hit just a little prediction, folks. Watch how we'll continue to hear stories about younger people being affected by COVID. Just my hallucination. Why would that happen, ladies and gents? Why would we suddenly hear more stories about to have a vaccine approved? Interesting. Just skeptic corner over here for the minute. Join me if you will. But I shouldn't laugh because it's not funny at all. But nonetheless, it's just classic rhyming. But just hold that thought for the minute. Part of living with COVID means living with new a virus will evolve over time. It mutates, it changes. We know this is part of the natural evolution. For some reason, in the last 2 years, in this new paradigm, we've decided to make it a hysterical concept. Pre-trial and the history of the development of MS vulnerable people safe. And this line really cracks me up because, quite simply, if you're not infected, you cannot infect someone else. Well, lo and behold, common sense. Do you remember? Yet we've locked people down for days on end, weeks on end, who weren't infected, and not allowed them out of their home and just let them walk for an hour a day. If you haven't got the virus, you're absolutely right. You can't pass it. We were even told throughout the pandemic in Britain to act like we have the virus. Oh, goodness me. You can't even make it up, can you? I still, like I said, pinch myself. Like, what is the world that we've come into? So absolutely. So the point around that is also this, that whether you're vaccinated or not vaccinated, it doesn't matter. It's whether you're infected. Because if you're infected, you can pass on the virus. So for the healthcare workers, whether they're vaccinated or unvaccinated, for the population at large, whether you're vaccinated or unvaccinated, it's irrelevant unless you're infected. Anyway, we continue. Balance against this clear benefit was the risk that there would always be some people who would not do the responsible thing. And you watch the language throughout the entire speech about do the right thing, do the responsible thing. Behavioral science, manipulative language, coercion, all throughout the statement, all deliberately written into the statement and used throughout. It's all priming. We're going to do a lot more on the pandemic podcast on this. We're going to extract, a lot of the materials that has got deliberate behavioral science used to show how that people have been coerced. Nonetheless, we digress. So here's the really interesting point in his statement here. Balance against this clear benefit was a risk. There would always be some people who would not do the responsible thing and would choose to remain unvaccinated, and in doing so, choose to walk away from their jobs in healthcare. So they're clearly stating that they weren't responsible. The government's mandate wasn't going to be responsible for this wide sweeping loss of jobs, livelihoods, and healthcare standards as a result. No, it was their choice to leave. It as their choice. Absolutely not. I mean, there's plenty of related examples I could give there that just are not savory in nature, but illustrate the point around informed consent. At the heart of this debate is not the vaccine, it's the informed consent. Although the vaccine has its own issues that should play a role in this function, because there are still widespread variance in the analysis of safety and efficacy, and the science is not settled in that regard, and there is plenty enough evidence to show that there are the risk-benefit ratio is not equal to all, and an increasingly understanding as we start to increasingly understand both components, the efficacy and the risks, then we can quite clearly see how mandates are just not appropriate. So again, it reinforces it, despite being their choice. Sector who already lost between 40 and 100, obviously have a knock-on effect on this, because if the care homes can't cope, then where do the patients go? Of course, they go to hospital. So again, this is all positioned as though it was their choice. The NHS is their fault. And let's not forget, during that peak hysteria of 2020, where no one had a vaccine and everyone was praising the healthcare workers, clapping on the streets every week, pots and pans, celebrating our beloved heroes. Yet choosing to natural herd immunity that is built during that time. There is just so many fallacies to the argument. It's untrue. This is all right. We made the wrong call. I mean, that would just take transformational leadership, wouldn't it? That would take humble leadership with humility. But in my mind, I would much prefer to have a leader in place that said, you know what? I've made a mistake. I screwed up. We're changing the way we're doing things. We've learned from our mistakes. Things right for those who have been ill harmed by these policies, and we're going to make it right. I would have infinitely more respect than this weaselly political posturing that comes from various members of the current government. So in here, it continues. In December, I argued, and the House overwhelmingly agreed. Yes, the MPs who are so deeply well informed. You can't even send a freedom of information request to the MPs to actually understand where they've got their evidence from, because the policy isn't there. Which, hold that thought. I have a campaign in my armory ready to challenge that and change things so that we can start to put some proper accountability in our British government. But hold that thought. We'll come to that another day. There are more pressing matters, but we will come to that. The House overwhelmingly agreed. Well, there was plenty of disagreement. And again, the MPs are hardly the best informed people when it comes to making these types of decisions. Despite all of our best efforts, they simply will not listen to the evidence. And it said the weight of clinical evidence in favour of vaccination as a condition of deployment outweighed the risk of the workforce. That at no point has been true. It's just fundamentally incorrect. And again, it's all weaseling. It's all political posturing in failing to acknowledge that they just simply got it wrong. They said it was the right policy at the time, supported by the evidence. They keep reinforcing that. Again, it's a method of persuasion. And importantly, the government make no apology for it. Now, that has gone down like a lead balloon, my friends. We use blue balloons to symbolize the jobs over jabs as part of our campaign. This particular statement has gone down like a lead balloon amongst the care homes, and I'm not surprised one iota, because, of course, they have suffered through the winter. Now they've U-turned. They've now got to go through all kinds of hiring. They've gone through all kinds of pain and stress. And they are now asking, quite rightly, for an apology. But so should the NHS workers, so should everyone that's affected, because they have been affected not only in terms of concern for their jobs and their livelihoods, but all those people who have to plan the workloads and manage the responsibilities of patient care. And the patients themselves have suffered as a result of this woeful and egregious error upon the government, yet they are fundamentally denying that it's their responsibility, and they are not making an apology for it. Case in point around transformational leadership being woefully lacking. A transformational leader, in my view, an evolved leader would simply hold up their hands and do the right thing. If you're going to use the phrase do the right thing, you've got to be willing to walk the talk yourself. And it even concludes here, it also proved to be the right policy in retrospect. Given the severity of Delta, please, please, please do me a favor. Oh dear. You can't make it. It's no. Don't even need to say anything. Anyway, let's carry on. So obviously not going to go through the whole speech here, but this is the final point where we must remain vigilant, because these three conditions at the end of his statement are deeply concerning. Firstly, the mandates in terms of legislation may have passed, but this single statement is deeply concerning on the basis that the mandates may still exist by coercion. So, first, I've written to professional regulators operating across health to ask them to urgently review current guidance to registrants in England. They will consult on strengthening requirements in relation to COVID-19, including reflecting the latest advice on infection protection control. The vaccination status of their employees, both in terms of new hires and renewals of contracts and deployment, which is deeply concerning. So on one hand, it's a small victory. We see the back of the legislation, but on the other hand, the past is now the buck passed to the other parts of the public sector through the NHS. So there is reason to act with caution, in the same way that people celebrated when the JCVI rejected the approval, did not approve the COVID vaccines within the 12 to 15-year-olds, yet then the decision was passed to the chief medical officer, who made the same is very possible here. So whilst it's true that the legislation won't be enforced for the NHS workers and the care workers, I would stand your guard and join a union that is fighting your corner, and of course stay connected with all of us who are campaigning this issue, because it's important that we finish the job. So it's important that we have this this in our minds as we move forward. So I just had a message as I came back from that screen to say that you may have lost my broadcast there. That's really frustrating. I don't know what point you lost me, but hopefully you caught the majority of my rant there because I was on a roll. So we must remain vigilant, and of course, this is one small step against mandates. But we must more broadly kick these into touch, both in England, the United Kingdom, but more extensively around the world. And it's our belief, speaking to a number of different campaign leaders around the world, that we have the opportunity to lock arms across the world now with one or two big pushes now to kick these these mandates into touch, and the opportunity to remove all restrictions around the world. So it's down to us. I was cutting in and out a lot. That's such a shame because I was really going for it. I do apologize for that. I'll have to look into that. Thank you for letting me know in the comments. I hope it's recorded in some way. But yes, so the conclusion to this broadcast is one step for the mandates, indeed a big leap for the NHS workers. It's great news. We do need to celebrate that victory on the basis that our campaigning has forced the government to change its decision. That's the fundamental piece we should take from this, is that we have the opportunity as the public, as we've talked about throughout the last 2 years, to put pressure on these ministers and on these central authorities in order to resist these mandates and restrictions. Now it's time for us to do this around the world, and we will continue. We will continue until there are no more mandates and there are no more restrictions, and then we will begin the process of seeking accountability and justice. So really important that we continue the cause. Let's remain vigilant, remain cautious, but simultaneously we must claim these small victories on the way, because this is not Omicron. This is the result of our campaigning that put the government into a corner, and it was forced to turn its course. So we will continue to do that until the right thing has been done. So let's join the cause and keep focused. And we will continue piece by piece to challenge the mandates, restrictions in every part of the world, because no one is free until we're all free. And it's down to us to create that change. Now, speaking of creating change, I want to end on this. Yesterday, we launched our private online community, the Elevate Network. Super exciting platform. It's a private platform for those who wish to elevate humanity and enrich the world. This is a place for us to have transformative conversations about not only how do we resist the old, as in tackle these types of mandates and restrictions. Activism is surely a component of that. But we're more importantly beginning to turn our focus around how do we transform ourselves? How do we transform the world around us? How do we begin to lead change? How do we start to rebuild and reimagine and move forward in a way that protects and defends our freedoms in perpetuity, but also looks at how we can really reshape the world in the wake of COVID-19 and everything that we've learned from what we've seen unfold over the last 2 years, and how we can begin to shift the trajectory of the world. It's down to us to do that. It's down to us to heal the divide, and it's down to us to create a new story for the world as we move out of COVID-19. So if you're interested in being part of those types of conversations and working with us, please come and join us. We just launched yesterday. Join us at weareelevate.org. Weareelevate.org. Join us inside of our private community. Set up your profile and come and join the conversation, because the party is just heating up, and it's down to us to affect the change in the world. And there's so many exciting possibilities for us to do that. And we'd love to all.